Okay. Yeah, thanks, Paul. All right, I'd like to welcome everybody to the Ashland April 2nd, 2024 Board of Health meeting. Just a quick disclaimer, this agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other agenda items or other items not listed may also be brought up for discussion to the extent permitted by law. So we'll call the meeting to order at 6:03, and after that, as always, the second item is citizens' participation. Usually Mark DeSoni's here, but he's not here tonight unless he's calling in. Anybody like to say anything about anything? No hands. Okay, everybody's just waiting for the item 3, which is the 7th annual Mary Mortensen Public Health Award, and this year's recipient is certainly deserving, as of all the previous recipients as well. Jay Byrnes, who has done a lot, not only for the board but also for multiple communities around the area. And not only has he decided to bring this remote area clinic to Framingham and Ashland and the surrounding towns once, he decided to do it again for some strange reason. So he really, to me, is very deserving in this award. And I would like to, have Diane Mortensen come up and just give a little bit of history of why or you can stand or whatever you want to do, or you don't have to. You can, if you don't want to, but I like the personal touch, and certainly she knows all the accomplishments. Is there anything that you don't have to? Would you like me to just read these? Okay, you want me to just read these? Okay, these are just some of what at least Laura, who's been at the Board of Health for I don't even know how long, way before I got here, and I'm sure everybody else knows how long she's been here, but some of Mary's, accomplishments surrounding public health. Ashland's first female call firefighter, working on the department from the late 70s through the mid-1990s. She started an annual bingo night 30 years ago that served as the fire department's biggest fundraiser, which paid for town activities, local scholarships, and more. And she was an advocate for the Ashland Emergency Fund. She was a Board of Health member, assisting in creating local regulations to protect youth and community members for head concussions, pesticide regulations, food management regulations. She assisted with DEP in reshaping the Howell Street landfill, and following compliance, she created a SHARPS program, including obtaining grants for purchase of containers. She participated in Ashland Nyanza Health Study as a board member and chaired organizational meetings with families and the state DPH. She was a member of the local emergency planning committee, coordinating health and safety matters. She was leader as a board member and chair, making Ashland one of the first communities for prevention of environmental tobacco smoke, restricting sales of all tobacco products to persons under age 21, and restricting sales in pharmacies and health institutions. She helped create programs for mercury and lead paint collections, supported recycling initiative programs, which allowed for grants to be obtained for the recycling program. For many years, she worked with the Board of Health, even when she wasn't a member, as a volunteer RN, certainly during H1N1 vaccine clinics and flu clinics, as well as housebound patients. She worked with schools on health initiatives, including tobacco for prevention, tick and mosquito education, and H1N1 support. She was a longstanding member of the Medical Reserve Corps. She created regulations for internal and external grease trap for food establishments. She created food inspection programs, tobacco compliance officer position, and animal control officer. She worked toward charter change for the Board of Health to become a 5-member board, and she worked to create charter change for the Board of Health agent to be under the town manager. So, and that's apparently only some of the things she did. So, your mom and your mother-in-law, definitely did a ton for the town, way more than I think, certainly I've done, and, she spent a lot of time at it. And this is just a little bit about our recipient this year. Jay, he's done a wonderful job. I know he had a lot of help, so he's got a lot of people to thank. But I just wanted to read this. I don't know how many people have had a chance to see this. Congratulations to John J. Byrnes, recipient of the 7th Annual Mary Penny Mortensen Public Health Award. Jay's a current member of the Board of Health and was nominated by residents of the community who know his work with remote area medical clinics and his success in bringing the RAM clinic to the Metro West area in 2023 and now again in 2024. Jay's fellow board members agreed with the nomination and voted their approval. Organizing a free medical clinic of this scale is a great undertaking. Jay began preparations well over a year in advance of the 2023 clinic, which served over 300 uninsured or underinsured people with free medical, dental, and vision services over a 2-day period. Jay learned about RAM, a nonprofit organization, in 2005 and has volunteered in many RAM clinics and events, traveling to Tennessee, Ohio, New York, and providing mental health support and running the medical floor. The Board of Health is honoring Jay today with the president of the with this award for in Mary Mortensen's name. This was established in 2018. Mary was a long-serving member of the Ashland Board of Health and devoted medical professional who volunteered her nursing skills during many vaccine clinics and all the other things that we just mentioned. Past recipients of the award include Ed Hart, who is here tonight, and thank you for all the stuff, especially all the hazardous materials and pesticide, this book that's about that thick, bigger than War and Peace, that you took the time to put together for the town, and that is still, I know, in force and used today. Janet, hopefully I don't kill your name, Gamash, hopefully decisions at every turn. Ed Berman, thank you. He does everything under the sun. I personally call him Superman. The COVID response team, police, fire, and school nurses, and Marie Kane. So, Jay, thank you for everything, and, please, I think you have a few people to thank. Yeah.
Turn this on. So, yeah, I wrote up a few things I'd just like to read, and thanks, Ron. I am humbled and definitely honored to receive this. Thank you very much, and thanks everybody for coming tonight. This is great. In reading about Mary's numerous accomplishments and hearing them just now, it's clear that she was an outstanding example of active citizenship. When she saw a need or identified a problem in the community, she worked to solve it, building awareness and support to help find solutions. I think all the members of our community host group that worked so hard to bring the RAM clinic to our community tried to model that spirit, working together to address an area of need and then finding so many like-minded volunteers to help in that effort. It was really a wonderful thing to be a part of. So I hope you'll be patient with me as I try to thank the many people and organizations that made this clinic possible and who are working now to bring the clinic back in August. So first, I'd like to thank Remote Area Medical for their staff, volunteer corps, logistics, equipment, and overall professional know-how. RAM has worked for over 40 years to advance their mission of alleviating suffering. This is a wonderful organization, and it was a privilege to work with them in our community. Keefe Tech High School, the school committee, and the outstanding facilities, maintenance, and janitorial staff that were so accommodating from the very beginning. We could not have asked for a better venue partner than Keefe Tech. To all of the volunteers, our 200 professionals, overnight and daytime parking lot staff, translators, and general support staff, thank you all very, very much. And we very much appreciate the efforts of our local partnering organizations that were on site and helped with medical follow-up, health insurance enrollment, and access to community services, namely BRACE, Metro West Care Connection, and the Latino Health Insurance Program. And of course, a big thank you goes out to all the patients that put their trust in us. I also want to thank the generous sponsors and others that provided in-kind donations: Middlesex Savings Bank, Eastern Bank, the Metro West Health Foundation, Morgan & Morgan, the Town of Ashland, Metro West Medical Center, and specifically Addie Gibson, the Community Foundation for Metro West, who is our fiscal agent, Trauma Services, who handled the biohazard disposal needs, the MWRTA, who ran advertising for us in their buses, Loring Arena, they donated their space so that we could run a vaccine clinic in parallel with the event. And then all the individual contributors for the support that made this event possible. I want to give a big thank you also to the Ashland Health Department and the Board of Health, Raj, Laura, Ron, Ed, Barbara, and also to Jennifer Wolfing and to Kristen French from the Department of Human Services and Decisions at Every Turn. Thank you all for all the support, the on-site help, and the legwork and planning for this event. And finally, I'd like to specifically recognize and thank members of our community host group leadership team, all of who are here tonight. Steve Mitchell, hospitality chair. Steve organized and managed our exceptional food and housing services, which are such a huge component of the RAM Clinic. This involves logistics of feeding hundreds of people, 6 meals on consecutive days, and I think it's safe to say that Steve has raised the bar for future RAM clinics, and we all know that RAM is still talking about the food at the clinic. Thank you very much, Steve. Bonnie Mitchell. Bonnie played an important role in keeping us organized by maintaining meticulous records of all of our planning meetings. She also worked some very long days in the kitchen as part of the hospitality team, and importantly, very early on, Bonnie established an extremely important in connection with Framingham State University that was key for housing our RAM staff. Thank you, Bonnie. Ed Hart, promotions chair. Ed went above and beyond to get the word out to patients, volunteers through flyer campaigns, electronic communications, and good old pounding of the pavement. I don't think that there's a food pantry in Metro West that is not aware or knows Ed at this point, and his efforts were a huge success, as we know. Thanks, Ed. Ed Berman. Ed was our recruitment chair, and he did an incredible job bringing on healthcare providers to the clinic. But more than that, Ed seemed to know everyone in Metro West. And of course, he has an endless supply of energy, so if I needed anything at all, I would ask Ed, and he found a way to get it done. He would just text me and say, done. And that included moving a ton of school buses at the last minute. Thank you, Ed, so much. And last but not least, Liz Byrnes. Liz handled all of our fundraising. She's a master grant writer. She gave us all peace of mind in knowing that we would have the financial backing to support the clinic. She played a very important role at the clinic as a jack of all trades. And overall, she was a very trusted advisor to me, a confidant, consultant, an invaluable asset. Thank you, Liz. So these were the members of our CHD leadership team. They did so much more than what I'm describing. They wore many hats, and honestly, I've never worked with such a capable, dedicated, and enthusiastic, cohesive team. These were really the people that made it all happen. And they were always focused. They never dropped the ball. And for that reason, I'd like to accept this award on behalf of the entire team. Thank you.
On behalf of the entire Board of Health, I'm not going to read this entire proclamation because it just reviews all the great things that we did, but I will read the now. Therefore, we, the Board of Health for the town of Ashland, do hereby recognize and honor Jay Byrnes as this year's recipient of the Mary Mortensen Public Health Award. We urge all residents to make known their appreciation for Jay Byrnes' devotion to the town of Ashland. We wish him good health and good fortune. Congratulations. Laura, you should get in there.
Can we also get a picture with the leadership team?
Sure.
What's that?
So you going first?
Yeah. If that's okay. So, well, first of all, I just want to thank you for inviting me to be part of this. It was a total honor to be asked and to be part of this team. But you're being way too humble, I think, in a lot of your description in terms of what you brought to this effort. And we're talking 18 months and all of the logistics, all the time and energy you put into it was far and exceeded, I think, what the rest of us did. So I think we do have to acknowledge that. And I know you're politically correct when you talk about the RAM group, but let's be real as well, because they could be difficult to work with. And Jay was the point person, and he massaged all that. That was part of what he brought, I think, to this bringing this clinic. And I just quickly, the last thing, the takeaway for me, the big takeaway, and I think we all have a sense that there's a population out there that's underserved and uninsured. And I just, I knew that intellectually, didn't realize it until I took part in the clinic and saw, people showing up on bicycle, people walking in at 3 a.m. to get in line. Just this, we turning people away, unfortunately, because there was such a volume of folks. And, I think we learned a ton of stuff last year, and hopefully we'll bring that to this year's clinic and make it a little bit better than last year. So, again, congratulations, and thank you.
Well, everybody knows that this is tough for me. Every year that we get up, I can't believe it's been 7 years, but I just, on behalf of the family, want to thank you for honoring Mary. I apologize. She did a lot for this community. She would have been right there at the clinic with you. This is very much up her alley. She gave a lot to the town of Ashland, to the fire department, as well as to the citizens. So, again, I just want to thank the board for continuing this honor. Thank you.
Thank you. Well said.
So, a lot of people probably have a few better things to do than to listen to the rest of the meeting. So I'm going to use the motion to have a little bit of a recess so we can, chit chat for a few minutes and when we take off, we can be here.
Was that a motion?
Yeah. No, you guys, somebody else has to make it.
Okay.
Okay. I'd like to welcome everybody back. We'll resume at, Raj, I'm going to use your phone again, at 6:28. And Raj, I'm glad I don't have to follow that presentation, but because you're next on the agenda, health directors. Oh, no, actually, I'm sorry, Jay, you got to follow yourself. I missed 4. RAM clinic update by Jay Byrnes.
Okay,
Please.
so there are no updates since the last time we talked, at least for me, but for you guys, do you have anything to update on?
I made 2 presentations to try to get more volunteers. One was at the Metropolitan Boston EMS Council Region 4 meeting. More to follow on that one. And I can't remember from the last one, also at the Metro West Regional Transit Authority meeting, Board of Directors meeting. We put that out to all the cities and towns that the Transit Authority uses.
Okay, and for the first one, who's the audience for that?
It's the hospitals and the ambulance services all in Region 4.
Okay, and you talked to them last year, right?
Yep.
It's the same group? Oh,
Correct.
so- nice, thanks, Ed. Okay. All right, I think that's, yeah, I think that's it.
What's your most major thing that are doing, still fundraising?
Fundraising. And, yeah, and interpreters, yeah.
Yes, anybody that's watching, if you're an interpreter and can volunteer, please, we need interpreters.
Yeah, exactly. So I'm taking this Metro West leadership training course with the Metro West Health Foundation. I will ask them, and Raj had done this course before too. I'm meeting with them tomorrow. I will ask, put the word out. There's 9 other people taking it, and they're all like health department employees and things like that. So I'll talk to them about it tomorrow. But
And I didn't check the sign-in sheet the last couple of weeks, the sign-ups, so I'm not sure what we have at this point.
I've looked at it. I'm not sure it looks any different than the last time, but we are meeting with, I think we are meeting with RAM next week. That's the second Tuesday of the month, so we should be meeting with them, and they should be checking it before our meeting. So we'll ask them how they think things are going. So, but yeah, definitely translators, I agree, Ed, so I'll keep my eyes peeled. Yeah, thousands, exactly.
And Dr. J, just a recommendation, right? I don't know if you want to check with the RAM team, right? So we, at the vaccine clinics, right, we have access to free lines, right, that we call interpretation line.
Yeah,
It's
right.
like under a federal program, maybe, it's valid for that too. And there are like plenty of interpreters available on the phone line that we can use in case we don't get in-person people. And it works wonderful for our clinics. So if you want to check with them, like, hey, it should be cleared for some program like that, but we get our interpretation line from DPH, for the vaccine clinics.
Is there any information you can send to me, and then I can get in touch with them?
Right.
Some kind of contact information?
Sure, I can check. I just want to, if you want to check that if their program is, eligible for free interpretation from the state, something
Okay,
like that.
and what is it what is it called?
It's like, the that's how they work, right? Like they do in person or it can be on phone.
Right, but through what organization?
We have it under DPH, like the
DPH,
Department of Public Health.
Okay,
Yes.
got it. Yep, I can find out about that too.
Thank you.
Yep.
But that's going to help, that's going to help a lot, in case I guess they cover over 200 languages, so the line.
A live person on the phone?
Yeah.
That is correct,
We
yeah.
do that at, Newton Wellesley has somebody contracted out. So if I have somebody, I get a Russian-speaking person today, all I have to do is pull it up on an iPad.
Yeah.
It's great.
There was a phone number that we used last year. It was in one of the treatment rooms. Do you remember that? It was written on a whiteboard?
That was our number
Yeah.
that we had from here,
Okay.
that we used during COVID. That was the number
Okay.
I brought it over with us.
Kidnap. Kind of.
That's the one that Raj is talking
Yeah,
about.
that's
Oh,
what he's
okay.
up-
Yep.
Yeah.
And I have it on my phone set up, but
Yeah.
we have a couple of other phones that our nurses have. I just want to make sure that if the program is eligible,
Okay.
I mean, backup, we'll use our lines, should not be a problem, but if the program is eligible, we can get as many lines as needed,
Okay.
Yes, that would be great, because that way you wouldn't have to worry about, having a ton of,
Just
in person.
But again, if we can get a
Yeah,
live person,
no,
there's
it's-
gonna be
it's-
so much value.
Yeah.
Yeah, yeah, because I think a lot of, at least from my perspective, it's really needed in the parking lot, because there's a lot of, there can be a lot of confusion in the parking lot.
Yeah.
So I'm not sure how well that would work out in the parking lot.
No, you're right. There, you probably need, right, but
You need-
as far as, you know, when anybody's with a professional, I think, you know, having it on the phone would be fine.
Yeah, okay. Okay. Thank you.
Yeah. Okay.
Yeah.
Great.
I'll follow up with you on that, Ed, too. Okay.
Dave, Barbara, everybody good? Okay, all right. Thanks, Jay. We'll move on to item 5, Health Director's agenda. Raj, you're up.
Thank you, sir. So first item, the public health nursing staff. As you know, Jess is leaving us end of this month. So we have posted the job. We have 3 candidates that have already applied, you know, and Sergeant Berman or, you know, Barbara, you are from the field, you know, if you know anybody. The main requirement is if anybody can cover our Wednesday clinic, you know, so that's what we'll be looking. We posted the job for up to 19 hours. And for right now, Bridget Hurley, she's our regional clinic nursing person, you know, from the shared services. She came to 2 of our clinics, you know.
Raj, on that, when you do go to interview people, the nurses that you do interview, can you make sure one of your questions that they have no concerns about vaccinating? Because there are some nurses that will not vaccinate.
Right.
They just do not like doing that.
That is correct. So, I mean, our biggest need is the vaccinating nurse, you know, so yes, you know, that'll be one of the, thank you. It was last week I presented in front of the Ashland Citizens Academy. There are 16 wonderful people from the community who came there, you know. The biggest point from our health was like we are short 10 vaccine shots of 3,700 vaccines from the time we have started this clinic, you know, so that was the main point from the health department, besides other things. And 3 other departments was with us. It was library, conservation, sustainability, and health, you know, so presented in front of them, sorry. And the Easy Convenience on Pond Street is still undergoing the ownership change, and they're going to be finishing that up in mid-April. We'll be setting up 2 emergency shelters again for Boston Marathon on April 15th. One will be at middle school, other one will be at the high school. We have asked for 4 Red Cross volunteers, and Dr. J have already said yes, that he's going to be in one of the sites. But if anybody of you have time, please come, you know, we can always use the help there. Last year, I guess we have 2 people who needed help, you know, one on your site and one at mine, right?
Not on my side.
I definitely had one person, you know, and like the marathon before that also we have one person, you know,
Yeah.
who needed.
If they were on my side, it was taken care of, it never got to my
Right.
site.
But I definitely had one person, you know, that we helped, you know.
Heart attack or some
I-
kind of cardiac?
Yeah, that was the woman.
Yeah.
But like one person just got like dehydrated, you know, so that's what I had, you know, so. But it's a good event, you can see the runners, you know, going through, but like, so if anybody is available, you know, I'll appreciate it. Then we have our meet and greet end of the month on the 30th. We're going to be bringing our MRC team here, you know, and again, I'll ask the board members, any community member who want to sign up, you know, for the MRC, that'll be helpful, you know.
I'm going to come. So,
Wonderful, sir.
Yeah, I'm going to sign up too. Yeah. So did you say, so is anybody else planning on it? Because I know you said you want to just at least post a meeting? just in
Yes,
case.
if we can,
I'm gonna go.
You're going to go, I'm going to go, you're going to go, okay.
So we'll
you're gonna
definitely
go,
post the
okay,
meeting,
So
you
we'll
know.
post a meeting.
wonderful.
Yeah.
Thank you.
Thanks, Laura.
Update on Mill Pond, a couple of things going on. This was on Monday, last Monday, I got a call from our plumbing inspector that they have some sort of backup. They was doing repairs in the kitchen, as mentioned in the last meeting, so they have sanitary backup, you know, in the kitchen. I did go out for the inspection, that it was all cleaned up. But then yesterday I got another email from the fire department that they had some sort of petroleum release while removing a underground tank. DEP is working on that. They have asked for additional soil samples, and I have limited information at this point, so we'll keep you posted. But there was definitely some sort of release of petroleum product in the facility.
How many people are living there right now?
Mr. Berman, last time I know it was 9. And when call last week with the administrator, I asked her, like, hey, if there is any update on the transfer, she said I have to talk to the ownership, so she was not aware. Housing cases, Chestnut Place Apartments, I have to issue a $100 citation yesterday. Again, a lot of trash in their dumpster area. And they have the change of management there, that there is a new company who's managing it. I went by today again, was no better, so I'll keep the board posted. Cirrus Apartments.
Sorry, Raj, is that overflowing trash, or is that just trash that's thrown next to the dumpster?
Right, so didn't see overthrowing trash, but like a lot of stuff outside dumpster, general unsanitation. And that was one of the requirements from the board, when they was in front of the board to send us pictures. So the new management have not started doing that, so, and I did email them like, hey, this was a requirement from the board, and I'll follow up. But it's just like when people throw their garbage, in the dumpster or, the compactor, there's a lot of like spills and all that, broken glass stuff, general unsanitary conditions, so that's why I have to write the citation. Cirrus Apartments, we had a meeting last Wednesday. It was town manager, all folks from are here. I went there. The building commissioner was there. Our planning director, fire deputy chief. Then we have our chief for fire. A PD presence was there. So we met with the management, right? How we can get the things get going, because there was a lot of stuff going at Cirrus, They're definitely better right now, right? But again, trash issues, we had like 3 or 4 housing cases, when we set up the meeting, town manager sent them a letter saying, like all the departments are facing challenges, so that's why the meeting was set up. There was somebody from their higher management flew from Chicago to attend the meeting, So we hopefully things get better, they have closed 2 out of the 3 cases, housing cases I had there. The trash situation is definitely better, So, 137 Pond Street, still with the AG's office, spoke to them last 2 or so weeks back. I don't have update after that. And 213 Trailside, the owner or the personal, owner's personal, the pulling permits to do the repairs. This was the case like this pending from like 3-4 months. The tenant was evicted, but now they are doing the repairs. With the disease investigation, still following up with the pertussis case, I guess there might be one person or one kid who had symptoms but didn't get diagnosed with pertussis, from the last one. We're following on that, and then we have 2 active TB cases that we're looking right now. We have set up 2 more clinics that's coming on April 9th and April 23rd. Now, these are the clinics that we are doing with the pharmacy, and we have done 17 so far this season. And this will be, if we add 2 of these, will be 19 clinics this year. And I'm open for any questions, please.
I'm just interested, besides COVID, what other vaccines do you plan on, on giving here?
So we are doing the flu, the
Yep.
COVID, then we are doing shingles,
Okay.
RSV, we are doing Hep B, TD, they're like 7 kind vaccines, that we are doing. I guess they're bringing HPV also there, so.
It's just odd to see, this time of year, odd to see the flu. I didn't realize you still gave it this late in the season.
Right, so, but we are still seeing influenza cases, I guess I saw 1 or 2 this morning, that coming
okay.
through, And some of the populations, right, like mainly to our clinics, right, especially the childhood vaccine clinic, we are still giving flu there, because people are still traveling, right, or or the populations that's coming in, so. But yes,
No,
but
it's
like.
smart. It's just odd for me to think in my own head, I'm always thinking about that in the fall.
Right.
For that, but, okay.
But it's just like for people who didn't get an opportunity or didn't feel like getting that time, But
Right.
we definitely see a couple of people who take it in every clinic, The demand is definitely less, like for
Yeah.
COVID also, right? Like last clinic, I guess we did total of 5 doses, in the combo clinic. But I mean, every shot for us counts,
No,
so
right,
whatever we
absolutely.
can do. But the childhood vaccine clinic, I guess last clinic we did 38 shots, so. That's like close to the maximum we have ever done in a clinic, with like a maximum of, like in the childhood vaccine, we have not done more than like 42 vaccines in one clinic, so.
Were those all Ashland residents, or did they come from any surrounding towns?
No, we are getting, kids from all neighboring communities, like we
Yeah.
are getting even from Milford, Millis, like that much is the dire need, right?
Yeah.
Like as we spoke about the RAM clinic, like the number of people who came to get services, the same with the vaccine clinics, like there is so much, still such a big need, right?
Yeah.
We've been doing this for like at least 2 years, still like the clinic tomorrow we have is almost full, so.
Yeah.
It's
No,
just-
I mean, that's great.
Right.
How do you just call your counterpart in those other towns and let them know that this is going on? Like, how did those other communities get word of this?
So, sir, there is a setup, right? So we have spreadsheet that we share with the communities, right? They put their kids in the list. So
Okay.
every school system, like we have, like Milford, we have a spreadsheet that share with them, so they put the kids on. And then according to what we can accommodate, we accommodate kids,
Yeah,
tell them to
that's
schedule them.
awesome.
But there's a lot of groundwork that goes into this, right? Because the language barriers or, we just want to make sure, because there's like 10, 11 kind of vaccines, right? That we don't over-vaccine or we don't give vaccine to anybody who doesn't need it, So we
Right.
just, there's a lot of background work that goes into scheduling it,
Yeah.
We just need to make sure that these particular doses they need, So the nurses work, it's more clinic in the background more work in the background than in the clinic itself, so. And that one thing we should do it in the RAM clinic this year as well, like, on a bigger scale, that that'll be great, just to take off that load, that we have in the area.
So when should we start thinking about that?
So, what I was just thinking, because Raj just said it. Raj, can we get that pharmacy scheduled to help us for those 2 days, do you think?
I will definitely check with that, Mr. Berman, but only thing is, like,
Right.
I guess the pharmacy take people who have insurances, so I just need to make sure that we check on that angle,
But maybe what they could do is if they might be able to get some of those vaccines for free anyway.
Right.
If they tell the state, hey, we're gonna be helping at this clinic, and that we get the extra doses we might need, because with the influx of the migrants this summer, there's gonna be all those kids that have to be vaccinated before they're not gonna be able to go to school in the fall.
100%, so, yeah, I will check with the pharmacy, and,
I know we have, Latino Health Foundation's gonna do some, but this way we could probably push through more people if we had to, if we have some extra hands.
Yeah, and since it's gonna be right on site, I imagine that
Right.
there'd be a bigger volume, right, this time?
Right.
Okay.
They can always say
Absolutely.
no.
So let me know if you need me to do anything with LHIP. Are you,
I think one of the things that we're gonna have to do is between Ashland and Latino Health Foundation is we're gonna have to make sure that we order enough vaccine.
Yep.
That we have enough vaccine available from the state.
okay.
I can definitely
Yeah.
work on that,
Yeah.
so. And I'll check with the pharmacy also and get back to
Just
the
see if
team,
they'd be willing to come help with that.
Absolutely, yes.
And it's just publicity for them too.
Yeah, right.
Oh, yeah,
That's great.
thank you.
Yeah.
I did remembered something, Raj, if I could ask you. So with regard to the health event that Kristen French is putting on, that we talked about having a table at?
Yes, sir.
Do you want to talk about that now, or do you want to just circle back later? And
We probably can do in the next meeting,
Okay.
It was not on the agenda because we signed it up, after we have sent out the agenda, you know,
Okay.
so we'll have that up, you know.
Okay,
But we're talking about our May event for the mental health fair that they're doing at the school. So we have signed up a Board of Health table, you know, and we'll definitely bring it in the next meeting. You know,
Okay.
We'll have the details.
all right, sounds good.
Thank you.
That's great. You all set, Raj?
Yes, sir.
And
Thank you.
anybody else? Anything else? No? Okay.
Thank
Very
you.
Great, thanks,
Thanks.
Raj. All right, moving on to item 6, the consent agenda. Anybody like to make a motion to approve the review of the Board of Health draft meeting minutes for March 19th, 2024, and to approve fiscal year and year-to-date budget reports as a whole?
I'll make a motion to approve the consent agenda as presented on the agenda.
Okay, any seconds? Okay, thanks, Barbara. All in favor? Aye, all right, that passes unanimously. And as always, on to the next, item 7, usually things get pretty filled up over time, but anything, pressing, I mean, is there anything with, usually springtime stuff with, maybe the waivers for the lifeguards and, the pool things, and I don't know if there's any, if there's like pest updates and mosquito,
think the lanterns.
spraying and that, or ticks, if anybody, I don't know if we want to do things like that. I don't-
The Lanterns has
And the-
that lifeguard waiver.
Yeah,
That was for
life-
2 years.
yeah,
And that's
lifeguard waiver.
expired this year, so yes,
Okay.
that will be on.
Yeah, and I think there's, I just had something else on my mind. Oh, it's, isn't there, at least try to mention maybe the Clean Up Ashland or Green Up
Green Up
Ashland, isn't that,
Ashland,
that's
yeah.
coming in May,
too.
right?
Yeah.
Yeah, sometime in early
Good
May,
points, yeah.
so maybe we can at least make some public service announcements regarding those things.
Wonderful.
Yeah, I mean, I'll certainly be there. And I know there'll be other stuff, but
Yes.
at least those things.
Sorry, just
Yeah,
one
yeah,
thing,
go ahead.
Jay, one other thing before we bring up, do we have like a PDF of, like, like with the volunteer information to sign up?
Mm-hmm,
I don't know if I have that.
I'll send it to you.
If you can, what I can do is, I'm gonna push that out through the superintendents of all the schools to their staff.
Okay,
That way,
Yeah.
probably get some good people.
yeah,
to help with
perfect. And definitely do that, but also remember that Ed Hart, so you guys are doing professional
it. Yeah,
recruitment, so definitely do that, but Ed,
but I'm thinking
Ed-
that's for the interpreters.
yeah,
The schools
yeah,
have
okay,
So many.
yep, sounds good.
Yeah,
All right, I'll send it to both of you
Right.
guys.
perfect.
Okay.
Anybody else with anything to add? No, everything good? Raj, you good? Yes, sir. Okay. All right, anybody like to make a motion to adjourn?
Yep, I'll make the motion to
Okay.
adjourn.
Second?
Second?
Second? All right, got a second. How about all in favor?
Aye.
All right,
Thank you.
it passes. All right, thanks, everybody. And 6:51, okay, good time.